Hello guys, welcome to this amazing YouTube channel Era of Medico again, and this is a long time that I have not uploaded any videos, any lectures. So we are going to start this with upper limb. So as you can see that we have started the systemic anatomy. तो जिसने पढ़ना स्टार्ट नहीं किया वो कम से कम अब तो स्टार्ट कर ही दो. तो आज मैं बुक से नहीं पढ़ाने वाला, मैंने अपने कुछ नोट्स बना रखे हैं, तो उसके अकॉर्डिंग ही मैं तुम्हें उसमें से एक्सट्रैक्ट कर करके बताऊंगा. तो फर्स्ट तो हम इंट्रो की बात करते हैं अपर लिम्ब की. तो अपर लिम्ब तुम जानते हो कि जो तुम्हारा पूरा का पूरा हैंड का पोर्शन है, इंक्लूडिंग योर शोल्डर गर्डल, that is the part we called as upper limb. So upper limb is divided into three parts. What are those parts? First is your proximal part that is across the shoulder portion. तो जो तुम्हारे मीडियल लाइन ऑफ बॉडी के नज़दीक होगा, नियर बाई होगा, वो तुम्हारा प्रॉक्सिमल पार्ट होगा. सेकेंड मिडिल पार्ट. प्रॉक्सिमल के बाद जो पार्ट आएगा उसको हम मिडिल पार्ट बोलते हैं. एंड द मोस्ट डिस्टेंट पार्ट फ्रॉम योर बॉडी फ्रॉम द मिडिल लाइन ऑफ योर बॉडी इज कॉल्ड द डिस्टल पार्ट ऑफ योर अपर लिम्ब. That include your fingers, your wrist, and etc. Now, this limb is supported by the pectoral girdle or the shoulder girdle. तो शोल्डर गर्डल या पेक्टोरल गर्डल जो है उसी ने तुम्हारे पूरे के पूरे अपर लिम्ब को सपोर्ट करके रखा है. अगर ये गर्डल नहीं होता तो तुम्हारे अपर लिम्ब को तुम सही से कंट्रोल नहीं कर पाते. और इसमें भी बहुत सारे लिगामेंट्स, बहुत सारे मसल अपना रोल दिखाते हैं, उनके बारे में भी हम बाद में बात करेंगे. पेक्टोरल गर्डल का क्या है कि ये कंप्लीट गर्डल नहीं होता तुम्हारा लाइक पेल्विक गर्डल, क्योंकि ये अटैच हो कंप्लीट गर्डल नहीं होता बिकॉज it attaches to axial skeleton only anteriorly. मतलब सिर्फ एंटीरियर पोर्शन से जो है ये तुम्हारे एक्सियल स्केलेटन, दैट मीन्स द मेन बॉडी स्केलेटन से ये ज्वाइंट होता है. ये पूरी तरह से पोस्टेरियरली नहीं ज्वाइंट होता है, ये सिर्फ एंटीरियरली ज्वाइंट होता है, इसलिए हम इसे कंप्लीट गर्डल नहीं बोलते. नाउ वी हैव सम पार्ट्स ऑफ अपर लिम्ब. पार्ट्स of upper limb, and what are these parts? So your first part is your shoulder region. The second part is the arm. We called arm in anatomy as brasium. The third part is your forearm, the part which contains the radius and ulna bone, and it is known as antebrasium, whatever you pronounce it as. Now the fourth and the last one is your hand, and it is known as anatomically manus. This is actually the portion besides the wrist joint, or you can say that it contains the fingers, your carpal and metacarpal bone. That means it is the most distal part of your upper limb. Now we are going to discuss each part in detail. So first we are going to discuss about shoulder region. All right. So shoulder region also have three parts. First is your pectoral part or the breast region. So the part anterior to your body, the anterior portion of the body, the part beneath your skin of your breast portion is called the pectoral part, and the second is axilla or your armpit. So the area between your upper humerus and the rib bones is known as axilla or armpit. Actually axilla तुम्हें बहुत इंपॉर्टेंट है पढ़ना. I will suggest कि तुम एक्सिला की वीडियोस पहले पढ़ना, बिकॉज एक्सिला के ही थ्रू जो है मोस्ट ऑफ योर लिगामेंट्स एंड मसल्स जो है वो अपर लिम्ब तक जाती है. इवन ब्लड वेसल्स एंड नर्व्स भी इसी एरिया के थ्रू तुम्हारे अपर लिम्ब में जाती है. तो व्हेन यू अंडरस्टैंड द मसल्स एंड द ब्लड वेसल्स, नर्व्स एंड एक्सेट्रा first, then you will find it easy to just remember the attachments in the bone. Now the third is your scapular razor. it is the reason on your back. Of course, a scapula is present on back, so it is the reason behind your back. Now, the pectoral girdle or the shoulder region have some bones that are known as clavicle and scapula. I am giving you the intro only of upper limb now, because we are going to discuss the osteology part, in which we are going to discuss each and every bone of your upper limb, and with the sequence we will discuss every bone in the osteology part of each systemic anatomy region. So what we are going to see in clavicle, that clavicle it articulates at sternoclavicular joints. Let me highlight this. So क्लेविकल जो है वो स्टर्नो क्लेविकल जॉइंट्स पे जा करके वहाँ पे आर्टिकुलेट करता है, वहाँ पे ज्वाइन करता है. स्टर्नो क्लेविकल को तुम जब डिवाइड करोगे तो यू कैन सी दैट स्टर्नो रेफर टू स्टर्नम एंड योर क्लेविकुलर रेफर टू क्लेविकल. तो तुम इमेजिन कर सकते हो कि इफ दिस इज योर स्टर्नम एंड दिस इज योर क्लेविकल, so the joints forming here is this joint is called as sternoclavicular joint. Now what about scapula? So scapula is joined with clavicle also at acromioclavicular joint. So actually your scapula is a triangular bone here. So the clavicle will joint here, across here. When we are going to discuss the osteology, I am going to show you the pictures more in a good way, that here the joints form is called as the acromioclavicular joint. So this is the joint which connects the clavicle with the scapula in the behind. You should also know that this sternoclavicular joint, it joins whole of the upper limb to the rest of your body. Now let's talk about the upper arm. This is all about the shoulder region. Got it? Now upper arm. When we talk about upper arm or the brachium, as I told you that upper arm is known as brachium in anatomical terms. So this is the region between your between shoulder and elbow joint. Elbow is also known as cubitus in anatomical terms. You should know these. That's why I am recalling that anatomical terms are really important to be remembered. And the bone it contains is known as humerus. We will talk about it in the osteology video. Now the third is your forearm or your antebrasium. What is good about this, that this contains two bones, your radius and ulna, and it is the region between, this is an ulna, and this is the region between your elbow joint and your wrist joint. I should recall that elbow joint is also known as cubitus. Okay. Now let's talk about your hand, the part behind or the part distal to your wrist joint. Hand. So we are going to see that it have many portions like wrist, which have 8 carpals, which are arranged in 2 rows. Just remember these for now. We are going to discuss every bone in the osteology part. It have hand proper or the metacarpals, which are 5 in number, and we also have 5 digits, that's your fingers, which contain 40 phalanges. 40 phalanges, in which 2 are in thumbs and 3 in your each finger. So you can see that 3 into 4 is equal to 12 plus 2 is equal to 14 phalanges. It is simple math. Now what is good about wrist joint, that wrist joint is formed by your radius and carpal bones. Don't confuse it with ulna. It is formed by radius, not ulna. Okay, and this joint is known as intercarpal joint. Let me highlight this also, intercarpal joint. Okay, there is also a second joint, that is the metacarpophalangeal joint. So this is formed by your phalanges, of course, with your metacarpals. The most interesting part about anatomy or reading anatomy is that if you break those terms, you can easily get the clue that what type of joints or what type of things we are talking about. Like here it is metacarpal, so of course metacarpal carpal bones are involved, and here is phalangeal, so of course phalangeal bones are also involved in this. So the next one is interphalangeal joints, and these are formed by your phalanges with each other, of course. Okay, now you should remember that metacarpals are numbered from lateral to medial direction. That means when you count any metacarpal, so you should remember that you should count your thumb first, and then your finger, and then your second finger. Not like that you are counting from your small finger first and then goes around toward the thumb portion. You should count toward the first to the thumb and then to the fingers. Okay, now we talk about the movement of upper limb. I am giving you the intro of upper limb in this video. The osteology part will be in the next video of this whole playlist. The movement of upper limb are at 3 points, like one at the hand, at a wrist joint, of course. Can you recall me the joint forming at the wrist? And that is your intercarpal joint. The second one is your thumb movement. Sorry, this is not the movement of upper limb, this is the movement of hand. Okay, so your thumb move at your first metacarpal joint, and you should know that this joint is not like other metacarpal joints. Okay, you have a metacarpal joint. These joint have, let me use another color, this joint have a separate cavity for itself, and this separate cavity allows thumb movement more freely. You can see that in your finger, when you in your hand, when you move your thumb, the thumb can be moved in all direction, but your finger can move only to flexion and to the extension type of movement. So this is the because that other metacarpal joints have not a single type of cavity, but your first metacarpal joints have a cavity that allows the thumb movement to a greater extent. We are going to discuss that the second to fifth digits or your finger have metacarpophalangeal joint and proximal distal interphalangeal joint. Okay, let me show you. As imagine that this is your finger, so you can see that here is it is a joint here, and then here it is a joint, and then here is it is your the metacarpophalangeal joint. So as you can see that this is your metacarpophalangeal joint, that because it is joining the metacarpal with the phalangeal, and these are the interphalangeal joint, interphalangeal, and this is your metacarpophalangeal, and this one which is proximal to the Metacarpal, this is known as the proximal interphalangeal joint, and this is which is distal to the body, it is known as the distal interphalangeal joint. And there is an important topic here, that how is the force is transmitted in your upper limb. So force transmitted in upper limb, let's talk about this. So first of all, when you try to hold something or try to just lift something, first the force come to your hand, then goes to wrist, then goes to your radius, and radius and ulna have an interosseous membrane between them. So through the interosseous membrane, the force transmitted to the ulna, then to the elbow, then to the humerus, then to the shoulder, then to the scapula and your clavicle, then your to the sternum, and there what is your axial skeleton. So this is the way that force is transmitted in your upper limb, and that what's make you able to just carry out the upper limb functions like lifting anything, and or supination, pronation type movement, for picking food, for grasping your things. Now when we talk about the development of upper limb, because this is also an important topic, this is the last topic of this video actually. So development of upper limb. So how does this amazing structure upper limb, which makes us able to grasp things, is developed? Let's talk about this. So development actually occurs at 4th week of gestation period, or your intrauterine life. Intrauterine life. I will use IUL for this in the upcoming videos. The anterior portion of your upper limb appears opposite to the cervical segment in your developing spinal cord. You will get to know about those in the general embryology part and further systemic embryology. In the posterior of the lower limb, let's not talk about the lower limb now, we are considering upper limb only for now. You should also know that when these upper limbs develop, so they are like a flipper of dolphin, you can imagine, that is used to swim in the ocean. So the fingers, the upper limb just appear as the same structure like the flippers of dolphin, and these flippers have two surfaces, one dorsal surface and one ventral surface, and also two borders. What are those borders? Those are pre-axial border and your post-axial border. Actually what happens that the pre-axial border faces toward your head, actually the developing embryo head, and the post-axial border faces toward the caudal direction. The nearest digit toward your face or the pre-axial border forms the thumb, and this occurs in both upper and lower limb. And about the muscles, nerves, vessels, they all goes through the axilla portion of your upper limb, or the show armpit region, as I have written somewhere. Yeah, here allows transmission of nerves, vessels, blood vessels of course, muscles, ligaments, and further things which are going to be discussed in the osteology and the upcoming parts, of course. So this is all for guys today's, and let me show you a diagram so I can help you visualize things more clearly. So this is your upper limb. As you can see that this is your clavicle. This triangular bone behind your back is called the scapula. This is your joint with joint of a clavicle with the scapula, and this is the here somewhere the joint with the axial skeleton. As you can see that this is the humerus, and the joint and the junction between the humerus and your ribs, this junction is known as your axilla. As you can see, the vessels are going through this portion only, not like from the upper portion. All the vessels, all the ligaments goes through this. This is your forearm consisting of two bones, radius and ulna. As you can see, this one is radius and this one is ulna. I have explained in the general anatomy part also which side is for the radius part and which side is for the ulna part. So go and watch the video if you don't remember that. This is your wrist joint, this is your carpals, this is your metacarpals, and these are your phalanges. The thumb has a cavity here which allows the free movement of the thumb. So this is all about the upper limb intro part, and the next video is will be on the, of course, think what it will be. So it will be osteology part of the upper limb, and I'm going to continue physiology and biochemistry, of course, as you have decided that the counseling has affected your studies, so I was paused to make the videos, but अब videos continue करूँगा जैसे ही तुम्हारी काउंसलिंग खत्म हो जाती है. तो थैंक यू गाइज, ये नोट्स मैं टेलीग्राम पे अवेलेबल करवा दूंगा, एंड कीप सपोर्टिंग अस, सब्सक्राइब द चैनल, प्रेस द बेल आइकन, press the like button also, and keep supporting.